Mental health and involuntary hospitalization. What is mental health? Mental illness can be defined as disorder that can affect an individual's mood, thinking, and behavior. There are many types of mental disorders that can range from disorders such as schizophrenia to disorders like depression. People can continue their day-to-day life with many mental disorders because even such things like nail biting can be considered a mental disorder. But in some cases, the individual may not be able to take care of him or herself and is not mentally stable enough to get help. So how do we determine which patients are mentally ill? The DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorder, contains information on the types of mental disorders and defines them. Physicians use the DSM-5 to diagnose their patients with the correct condition based on symptoms. What is involuntary hospitalization? Involuntary hospitalization is usually done to prevent an individual from hurting themselves or those around them. This action is usually taken when the person does not have the ability to make rational judgment or is not seeking necessary treatment. And it's involuntary because the patient can't leave whenever they wish. So who would qualify for this? So if they're a danger to themselves or others, so the patient has to be suffering from a mental disorder that will most likely result in bodily harm to the patient, people around the patient, or physical impairment of the patient. If they are gravely disabled, if they need immediate care and treatment, such as if they try to commit suicide, if they're unable to take care of themselves, or if they're unwilling for treatment, so not fit enough to continue as a voluntary patient at a psychiatric facility. So what are some of the benefits and disadvantages of involuntary hospitalization? So a benefit would include receiving treatment early on. So if the patient was involuntarily hospitalized at a time when they were not capable of making the decision, then it could prevent their condition from spiraling down or even prevent death because it's keeping them away from harm to self and others. So disadvantages would include sometimes it is harmful for the patient to be hospitalized, and it can sometimes be counterproductive. And sometimes there is forced treatment, such as the patient being given strong antipsychotic medication or electroconvulsive therapy. Another thing that is a disadvantage is the stigma of being diagnosed with mental illness. Those people tend to suffer discrimination from the outside world more than those who got outpatient therapy and treatment. According to the Canadian Charter of Rights and Freedoms, Section 7, everyone has the right to life, liberty, and security, and they shall not be deprived of the person unless it is in accordance with the principles of fundamental justice. The Healthcare Consent Act, Section 4. A person has to be able to understand relevant information and be able to see the consequences of a treatment, admission to care facility, or personal assistance service in order to be capable of consenting to it. So the Healthcare Consent Act, Section 21. If the person is incapable, then the decision is made for the person with the respect to their best interest. So when deciding for the incapable person's best interest, the values and beliefs, as well as the wishes expressed when the person was capable, should be taken into account. Another thing to consider is whether the treatment will improve the person's condition, prevent condition from deteriorating, or reduce the extent or rate of deterioration. And also whether the condition will improve, remain the same, or deteriorate without the treatment. The benefits of the treatment outweighing the risk should also be considered. And lastly, whether other more safer treatments are available, because if it is, then they should be going for that instead of the more invasive treatment. So this is just a controversial issue that I found was interesting because I heard about it in ethics class. So should an already detained person be allowed to refuse treatment? So in some cases, an individual is already detained because they are deemed dangerous, but within the facility, they aren't a danger to themselves or others. And if they understand that they have a problem, but they're still refusing the medication because they don't like the side effects, but they're doing it fully knowing the consequences and fully understanding why they need the medication, should they have the right to refuse? Because according to the Healthcare Consent Act, Section 15, a person can be capable enough to consent to some treatment and not others. And I do agree with this, that just because they can't be let outside because they're a danger to others does not mean that they have to take every medication that is offered, because they still have the right to decide for themselves. Okay, and these are my references. Thank you for listening. Have a good day.